As the COVID-19 pandemic evolves, people who use drugs continue to be at a greater risk of COVID-19 infection and complications. People who use drugs are more likely to get infected due to being in crowded environments, due to leaving their home or place of shelter, due to facing barriers to accessing drug services, safe drug-using equipment, and vital medications, and also when interacting with others to obtain their substances. Some people who use drugs were also at times living outside and had nowhere to isolate if they became positive for COVID-19. COVID-19 vaccines and boosters may therefore be an effective way to reduce potential harms of the virus among people who use drugs. However, evidence suggests that vaccine uptake may be lower among people who use drugs than the general population. Some people who use drugs report having concerns related to the usefulness and effectiveness of the vaccine and a lack of knowledge about the vaccine and its effects. Some people who use drugs also experience distrust towards government and healthcare agencies involved in vaccine development due to challenges related to stigma and negative experiences in receiving healthcare. How do we listen to and understand their concerns? How do we respond to their concerns in a helpful way? And how do we support them in COVID-19 decision-making? The following guide provides an overview of key motivational interviewing skills and strategies adapted for service providers. A helpful acronym to remember these strategies is OARS. Let's start with the letter O for open-ended questions. Begin conversations about the vaccine by asking an open-ended question. This allows the participant to guide the conversation. Remember, these strategies don't have to be linear and can be used throughout your discussion. To illustrate, we have Max, a person who uses drugs who is visiting his local harm reduction facility to use the consumption room and test his supply. Anita, his service provider, decides to ask him how he is coping with the pandemic.
Hey Max, how are you doing today?
I'm feeling good today. It's nice to see that things are finally getting back to normal after this mess with the pandemic.
I'm glad. I know it's been difficult for you with so many services being shut down throughout the pandemic. I'm feeling good about it too now that the vaccines have been available for some time and mask mandates are lifted. How do you feel about it all? Did you get the vaccine or are you planning to get it?
I didn't. I'm trying to find some good resources about it. I'm a little hesitant, to be honest.
Okay. What makes you hesitant about the vaccine?
Honestly, I'm not sure it's any useful. I had a friend who got the vaccine and they still got COVID. It's been said that the vaccine doesn't prevent it entirely, so I could get the vaccine and catch COVID. So there aren't really any benefits to me.
Now that Anita has had a chance to ask Max an open-ended question about the vaccine and started to build rapport, let's move on to A, affirmation. Affirmation involves validating the participant and expressing empathy towards them. This demonstrates that you are trying to understand the participant's position and acknowledging their concerns. Let's return to Max and Anita.
I appreciate you being honest with me, Max. It can be difficult to make a decision about the vaccine when you feel like you don't know if it really works or not. Only you can decide if it's right for you. Do you have some time to talk to me about it right now?
I just used the consumption room and I'm waiting on the drug results, so yeah, I do have some time.
The next letter is R, for reflective listening. This involves probing the participants' thoughts and concerns and summarizing them so they know that they are being heard. With reflective listening, you can also use the strategy Ask, Provide, Verify. Ask the participant if you can provide information about a given concern and then assess what they think or how they feel about that information.
Awesome. We can chat about it. So, I hear that you're unsure about the usefulness of the vaccine. What do you know about its purpose?
I don't really know much about it at all. I just thought when you get the vaccine, you won't be able to get COVID, but obviously that's not the case.
That must seem confusing to see that happen.
It really is. It doesn't make any sense to me.
Would it be okay if I share a little bit more about the purpose of the COVID vaccine?
Sure. Why not?
So, in general, vaccines of any kind, from COVID to chickenpox, are supposed to make it less likely for you to get a certain illness. But it doesn't make it impossible for you to get it. The most important goal of a vaccine is that it makes it less likely that you'll get really sick, have severe complications, or have to go to the hospital. It will make it more likely you end up with mild symptoms like congestion, a sore throat, fatigue, rather than something you need to go to the hospital for. Even though you can get COVID after getting the vaccine, the odds are much lower. How do you feel about that?
So the vaccine helps people not get very sick and doesn't stop the effects of COVID, but lessens them, right?
Yeah, that's correct.
I've seen most people describing it more of a cold nowadays, even my friend who got it. But maybe the problem is it was made just too fast, and it's not that effective. I can't really trust that.
It sounds like you have other concerns about the vaccine as well, and that you're unsure about the development process. Would you want me to provide some information about that as well?
That might be helpful.
So, vaccines are only given out to the public if they're safe, they work, and the benefits outweigh the risks. They're always tested for their effectiveness and safety by experts before they're given out. Because of the impact of the COVID-19 pandemic being so bad, this process was fast-tracked. More scientists and health professionals were working together, more funding was given to work on the development of the vaccine, and the review of the evidence was made a priority. How does that information sit with you?
That seems reasonable. I'm still a bit hesitant. Maybe it was developed safely, but how can I trust I won't have any side effects 5 years from now? No one knows what will happen in 5 years. Why would I trust that?
I hear you. It can be hard to trust in the unknown. Historically, long-term health problems have been extremely unlikely following any vaccination. The COVID vaccine was made with a technology that has years of research behind it, and these methods have been thoroughly tested. So the technology being used to create these vaccines isn't actually brand new. The COVID-19 vaccines are also being closely monitored, and so far the risk has been really low.
Thanks, Anita. I don't know. I'm still kind of iffy about it. The government hasn't been very nice to people who use drugs in the past.
I understand. I know there are reasons to be distrustful as a person who uses drugs. Your needs have not often been prioritized in healthcare. You get to choose what you feel is best for you. Our conversation is just about understanding your concerns and experiences with the vaccine.
Thanks for saying that. It really means a lot.
Lastly, summarize and plan next steps. If the participant is interested in vaccination, you can refer them to a location for vaccination or help them schedule an appointment. If they want to revisit, offer more resources and let them know that you're willing to have this conversation again. If the participant is not interested, close by expressing understanding and leave the door open if they change their mind.
We've talked a lot about your thoughts around the vaccine today. You were concerned about the usefulness of the vaccine and the speed of development, and I gave you some information about these issues. How do you feel about receiving the vaccine now?
I'm feeling better about it, but I'm not 100% sure. Is it okay if I follow up with you if I have any other questions?
Of course, Max, and I'm happy to provide you with some resources on the vaccine. You can take a look at these and think about your decision. I'll also give you my contact information later in case you want to reach out.
Anita showed an example of how service providers can use motivational interviewing skills to talk about vaccines with people who use drugs. Offer the time, space, and the environment for people who use drugs to digest information and ask questions.